Thank you.
Dr. Dinesh, okay.
We are introducing a new face to our moderator team, and that is Dr. Hema Sekhar from Trivandrum. She's
Thank
a
you.
medical officer. Welcome, Dr. Hema Sekhar.
Thank you, sir. A very warm good evening to all. Welcome to the 2000 day of an uninterrupted daily seminar of IFPH. Our today's guest is Dr. PAVITRA GAUR. She is a gold medalist in BHMS. Currently, she is working as the assistant professor in Department of Surgery, Swastika and Homeopathic Medical College and Research Center in Jaipur. She is from Jaipur. Today, she is dealing with the section Segmental and Cyclical Expression of Bothrops lanceolatus, Clinical Insights in Homeopathy. She has already presented 2 to 3 sections with IFPH. I welcome Dr. Pavitra Gaur on behalf of IFPH to deal with a wonderful section.
Thank you so much, ma'am. Am I audible?
Yes.
Okay.
Audible.
Thank you so much, ma'am, for the introduction. And now I would like to share my.
जुलूस निकलता है वीडियो ऑन था मम्मा हंस रहे हैं तमाशा.
Okay. So to begin with, for the today's session, the topic for today's webinar is segmental and cyclical expressions of Bothrops lanceolatus, clinical insights in homeopathy. So good evening, everyone, once again. Today, I will be presenting an interesting and yet evolving homeopathic perspective on Bothrops lanceolatus, a lesser known but clinically significant remedy derived from venom of Martinique lancet viper. This presentation is based on segmental and cyclical understanding of disease, where symptoms do not appear randomly but unfold in a definite sequence from mind to body, from function to structure. And you know what? What makes this remedy unique is that mental symptoms often precede serious physical pathology, giving us an opportunity for early intervention if we are able to recognize them. So these are the points which actually makes today's webinar a bit interesting regarding knowing the clinical insights of Bothrops lanceolatus. So for a closing line for the introduction, in Bothrops lanceolatus, disease begins as a closure of thought long before it becomes a closure of vessels. Okay. So these are some of the salient features of Bothrops lanceolatus. It belongs to Protelidae family. It's a yellow viper, Perdilance, Martinique lancehead, land snake, and Martinican pit viper. Venomous snake found in Caribbean island of Martinique. Proteomic studies reveal the following content in B. lanceolatus venom: acidic phospholipases A2, serine proteinases, L amino acids, oxidases, zinc-dependent metalloproteinases, and specific C-type lectin-like molecule. The name lanceolatus is due to the snake's flat mouth that tapers off to a point, like a lance. So, in homeopathy, actually, remedies do not act in isolation or randomly. Their action unfolds over time. In grave pathologies like stroke, thrombosis, or gangrene, symptoms do not appear suddenly, they evolve in phases. So there are certain phases in which the symptoms evolve in each and every medicines, and we need to know them. So this presentation will actually help us to know Bothrops lanceolatus early, understanding its progression and apply it rationally in serious vascular and neurological conditions. So as we all know, this is a snake remedy which has a strong thrombotic tendency. While many snakes remedies cause bleeding, Bothrops predominantly causes clot formation inside blood vessels. This thrombotic natures explain why this remedy is so relevant in modern clinical practice, especially in cerebrovascular and cardiovascular disorders. So these are actually the salient features which help us to further classify Bothrops, and we can say the clinical personality of Bothrops. So the central theme for the Bothrops lanceolatus is thrombosis. especially in large vessels. The brain is the most common part which is affected in the body, leading to stroke, aphasia, and hemiplegia. There is also a strong tendency towards gangrene and necrosis, indicates deep tissue destruction. So, whenever we see clotting, paralysis, and tissue death together, Bothrop should definitely come into our mind. Okay. So, starting with cycles and segments in Bothrop's lanceolatus. So, in chronic and serious disease conditions, pathology unfolds in cycles. A cycle represents repetition of disease activity, while a segment represents a phase within that cycle. In Bothrops, symptoms progresses from mental uneasiness to vascular blockage, inflammation, paralysis, and finally irreversible damage. Understanding this sequence allows us to prescribe at a correct stage of disease. So um, actually, if we are knowing a segment, we can actually prescribe the correct according to the correct stage of the disease if we are well versed with the symptoms and the phases or the segments and the phases. Okay, so the segments on which the Bothrops lanceolatus is based upon. It starts with the first point is thrombus formation, followed by fullness, which is the second segment. Third is the restlessness. Fourth is inflammation. Fifth is weakness. Sixth is paralysis. So these are the basic segments in which the symptoms of Bothrops lanceolatus falls upon. And if we know these symptoms, we can know that where to break the segment or where to end the cycle. Okay, so for the first segment is based upon two basic themes, that is the thrombosis and the closing up. So basically, first segment corresponds with the thrombi formation. So the mental symptoms in Bothrops are subtle, but actually they are very important. The pathology of Bothrops lanceolatus begins with closure, blockage, and rigidity. The physical closing up, thrombus formation, is reflected mentally as rigidity of thoughts and attitude. So, as we can see, the first segment is thrombosis or the closing up, and in that we are first looking into the mental sphere. So, the mental sphere is further divided into obstinate, haughtiness, and self assured. So, let's get started with more digging up into all these symptoms. So, meaning of obstinate. So, for Bothrops lanceolatus, obstinate here does not simply mean stubbornness. It means fixed opinions, inflexibility of thinking, refusal to accept correction or advice. Mental closing up, just like clot blocks a vessel. So, that is what obstinate corresponds in mental sphere and in first segment of Bothrops lanceolatus. That there is mental closing up and there is this kind of inflexibility of thinking. The patient, what will be the patient presents with? Is sure he is right. He is always sure that he is right. Will not change his decision even if proven wrong. This mirrors the thrombotic tendency. Once a clot forms, nothing flows through. So there is a kind of stagnation. There is not flowing of thoughts because there is a kind of stagnation that is a person has a person has faced in his mental sphere. So there is rigidity and inflexibility. Meaning of haughtiness. Now, moving on to haughtiness. This is better understood as haughtiness or arrogance. So this is basically arrogance, and the what will be the patient if we are dealing with the patient of Bothrops lanceolatus, how he even presents himself or herself, superior attitude, look down upon people, feels self-important and self-assured. There is a sense of I know better. So there is actually a sense of I know better, and we should not actually advise anything to the patient because he will not be able to incorporate or will be able to settle that thing in himself because he has that inflexibility of thinking and rigidity. So there is a thing that I know better. Again, this reflects mental isolation and inward closure, just like vascular occlusion. So the obstinate, haughty mental state is an early warning sign of deeper pathology. So the obstinate, haughtiness, and self-assured that he is always right, and he does not want to change his opinion regarding even though he is wrong. So these are the warning signs of deeper pathology. So what can be the clinical picture which we can observe or which you can observe? Such a patient may argue strongly with the physician, rejects suggestions, shows poor compliance. Okay, so in Bothrops lanceolatus, the clot forms first in mind as obstinacy before it forms in the blood. So if the mental sphere is affected, there is a kind of obstinacy, or we can say a synonymly that a clot is being formed in the brain. And that clot is actually a stagnation which results in inflexibility or the rigidness which a patient faces, and he is unable to change his opinion. And he is very much self-assured in his thoughts or his opinions. So he doesn't likes to be told. Okay. Now moving on to the physical sphere, that can be the thrombosis. So thrombosis can be a clot in the leg leading to thrombophlebitis, which is a very common situation with attendant symptom. It can involve the heart and may lead to a pericarditis or a heart attack. But most often for this remedy, we will see a thrombus in the brain leading to a stroke with major damage resulting. Interestingly enough, this tendency may become so strong, so intense that the patient may develop clots throughout his great vessels. So there is a core pathology. This is a core pathological segment of Bothrops lanceolatus. Thrombosis may occur anywhere, but the major locations in which the thrombosis can occur is leg veins, reducing thrombophlebitis, coronary vessels, leading to myocardial infarction, cerebral vessels, leading to thrombotic stroke. What is remarkable is the clotting tendency actually, which can become generalized, affecting multiple vessels simultaneously. This is actually not a localized pathology. It is systemic thrombotic disease affecting the systems in the body or the deeper organs in the body. Then comes the second segment, which is fullness in the physical sphere. And in this segment, the patient may tell you that during the pericarditis, he felt like a great weight was sitting on his chest, stopping his heart. Fullness in the stomach aggravates him. Fullness in the head, eyes, ears, or the throat are common symptoms of the remedy. So, if a patient has been dealing with the closed up sensation, and there is a feeling that everything is pulled up or filled up, and there is no room or no space to breathe. So there is a sensation of fullness in the second segment. So there will be fullness in stomach, which aggravates him, fullness in head, eyes, ears, or throat. And these are all the common symptoms of Bothrops lanceolatus. The patient might also say that there is a strong great weight which is sitting on his chest, or he's feeling that as if a strong weight is present on his chest, and this is resulting in stopping of his heart. So the sensation of fullness is very characteristic of Bothrops. This sensation reflects vascular congestion and obstruction, and it significantly aggravates the patient. So sensation of fullness also aggravates the patient, and if there is fullness, because of which there might be symptoms related to certain organs, which can be in stomach, head, ears, or eyes. And these can result in congestion and obstruction, and which significantly might result in aggravation of the situation. Then comes the third segment, which is restlessness. Restlessness physical, and in mental state, there will be a discontentment phase. So restlessness, this can happen before, during, and after the actual stroke. He may feel that there is something wrong with him. So the patient might feel that there is something wrong with him, and he is not being able to cope up with that feeling of being wrong. The restlessness is seen at night when he dreams of his condition and of his fate. He tosses and turns and may wake up frequently from his sleep. This restlessness is aggravating to this patient. So one of the oldest key symptoms of this remedy is aggravation by eating. His stroke may come on after a meal. Similarly, his pericarditis may be aggravated by a full meal. He may be he may develop some shortness of breath after eating, because basically after eating he has a fullness sensation of fullness in the stomach or the abdomen. So this might result in some of the aggravation of the symptoms like pericarditis or the stroke and shortness of breath. So the sensation of fullness is also very characteristic, and restlessness is also another characteristic symptom of Bothrop's lanceolatus. So restlessness, as we can see, it can appear before, during, and after stroke. It can worse at night with disturbed sleep, frequent waking, and dreams related to illness or death. This restlessness is not anxiety based, it is due to internal vascular distress. So, a patient might feel internal vascular distress. And so, one of the oldest key symptoms which we need to know is aggravation after eating. Strokes may appear after meals, pericarditis worsens after eating, shortness of breath may develop postprandially, and food becomes a trigger for a vascular catastrophe. Then comes the discontentment phase on the on the mental level. So patient enters a phase of discontentment, unsatisfied feeling, which results in irritability, dissatisfaction, and inner uneasiness. So the patient is not at ease. He is in a discontentment phase. This is actually not an emotional pathology, but a reflection of ongoing internal damage. So, ongoing internal damage, which is resulting in a discontentment phase, that he is not being able to cope up with the situation, whatever he is facing right now. So, this was about the third segment, followed by the fourth segment. So the fourth segment is inflammatory segment or the inflammation. So the inflammation in Bothrops is deep, destructive, and often gangrenous. There may be tissue necrosis, ulceration, and even bones laid bare. This indicates syphilitic depth of pathology rather than simple inflammation. So there is a destruction which appears in the body of patient if he is in the fourth segment or the inflammatory segment. So there may be tissue necrosis and there may be ulceration, and the bones may even lay bare. And this is a syphilitic tendency with which a person is dealing with. So the symptoms or the conditions with which the patient might suffer is clots, pains, shivering, and stroke. So these are the symptoms in the inflammatory phase or the condition with which the patient is suffering. Then comes the fifth segment, that is the discharges. So after the inflammatory phase, there comes the discharges, which can be in the form of bleeding or the vomiting and loose stools. So if there is bleeding, there can be in the form of hemorrhages from the eye or from the all the organs of the body. There can be bleeding because there is so much sensation of fullness that the body now needs to release in the form of discharges. So discharges can be in the form of bleeding, vomiting, and loose stools. So the patient, when discharges occur, the patient appears relief. So there is actually a relief from the discharges in the fifth segment, from which the patient gets ameliorated. And this is important modality and supports the selection of Bothrops. So this is actually an important modality which helps in the selection of Bothrops lanceolatus. So the weakness in Bothrops, then this was all about the fifth segment. Moving on to the sixth segment, that is weakness. And weakness can be in the form of physical weakness and mental confusion. So in the weakness segment, physical weakness. So the weakness in Bothrops is profound and disproportionate. So after all the segments which the patient has faced, starting from the thrombosis or the closing up, followed by the fullness, and then the restlessness, and then the inflammatory, and then the discharges, there is a profound weakness and the disproportionate weakness which the patient is dealing with. and which can be in the form of physical weakness and mental confusion. So the weakness in Bothrops is profound and disproportionate. It commonly follows thrombotic or paralytic events and reflect tissue damage rather than fatigue. So there is basically the tissue damage with which the patient deals with, and there is not that fatigue kind of weakness. And there is paralytic and thrombotic events in the body which they are facing with. Okay, so this was about 6 segments, followed by 7 segment, that is paralysis. And in paralysis, there are 2 symptoms with which we can judge Bothrops lanceolatus, that is aphasia and blindness. So what happens in 7 segment is paralysis is usually affects paralysis usually affects one limb or one side of the body. So one limb and one side of the body is affected for the in the segment, and hemiplegia is actually the common and often follows a thrombotic stroke. So after the stroke, the patient might suffer from hemiplegia, and the paralysis may follow a diagonal course indicating vascular origin. So this represents a terminal segment of pathology. So these are the terminal segments of pathology. There may be aphasia without tongue paralysis. There may be day blindness. There may be amaurosis and optic nerve involvement. Speech loss occurs due to cerebral damage, not muscular weakness. Not muscular weakness. So there is speech loss which occurs because of the cerebral damage. Why? Because there is the formation of clot in the arteries, which results in cerebral damage and not because of the muscular weakness that the patient has suffering from aphasia. So these were the segments with which the Bothrops lanceolatus can be studied well. And just to give a quick review, the first segment that we studied today was thrombi formation, fullness, restlessness, inflammation, weakness, paralysis. And in first segment, there was thrombosis and closing up. Mental sphere, there can be obstinate, haughtiness, and self-assured, and the patient is extensively rigid, and he does not want to change his opinion regarding anything, and he's very much like that he rejects suggestions, shows poor compliance, argues strongly with the physician, and there is mental isolation also, inward closure also, and there is a superior attitude with which the patient presents himself, looks down upon people, and feels self-important, self-assured, and there is a thing that I know better than you. And so this is the mental sphere in the first segment, followed by the physical sphere. The physical sphere results in thrombophlebitis and pericarditis or heart attack. And we can see a thrombus in the brain leading to a stroke with major damage resulting. Interestingly enough, this tendency may become so strong, so intense that the patient may develop clots throughout his great vessels. Second segment was the fullness and the physical sphere. So fullness can be resulting from the excessive of closing up or the formation of the thrombi, and fullness in stomach, which aggravates, and fullness in head, ears, eyes, or throat are the common symptoms of this remedy. And there can be pericarditis. He feels that as if there is a great weight which is sitting on his chest, stopping his heart. Then there is a third segment which we studied, that was restlessness. This can happen before, during, and after the actual stroke. He may feel there is something wrong with him, and the restlessness is basically seen at night when he dreams of his condition and of his fate, that whether he's going to get over from the situation or not, or whether he will end up in a very fatal condition. He tosses and turns, may wake up frequently from his sleep, and the restlessness is aggravating to this patient. So one of the oldest key symptoms is aggravation by eating. His stroke may come on after meal. Similarly, his pericarditis may be aggravated by a full meal, and he might develop a shortness of breath after eating. And there will be a discontentment phase that we have also studied. That is irritability, then dissatisfaction, and inner uneasiness with which the patient deals with internally. And this is actually not emotional pathology, but a reflection of actually the internal ongoing damage which is occurring in the body. Then we have learned regarding the fourth segment, that is the inflammatory phase, and which is actually very deep, destructive, and often gangrenous. And there may be tissue necrosis, ulceration, and the bones might laid bare. There might be clots, pain, shivering, and stroke. And this actually indicates syphilitic deep pathology rather than simple inflammation. So inflammation, it's not actually a simple inflammatory stages of uh, pain, redness, and everything like that, but it is a deep inflammatory condition, a syphilitic pathology with which the patient might suffer from. Fifth segment, we saw there were discharges, and discharges in the form of bleeding, vomiting, and loose stools. So, in discharges, the patient actually experiences relief from all the suffering of the previous phases of the cycle. And this is actually the important modality, relief from the suffering, relief from the discharges. So, this is an important modality and supports the selection of Bothrops. So, discharges can be from the bleeding in the form of retinal hemorrhages, or like melena, hematomasis, and in the form of vomiting and loose stools. Then we've learned regarding the sixth segment, which is the weakness, and weakness in the form of physical weakness and mental confusion. So the weakness in Bothrops is profound and disproportionate. It commonly follows actually the thrombotic or the paralytic events and reflects tissue damage rather than the fatigue. So there will be, because of fatigue, there will be mental confusion and physical weakness. The patient will be extremely frustrated regarding that. Seventh segment, the last segment is paralysis. And in paralysis, the patient might suffer from aphasia and blindness. And paralysis is usually, as we studied, is one limb, which affects usually the one limb or the one side of the body. And hemiplegia is common. So in Bothrops lanceolatus, hemiplegia is commonest situation or the condition which the patient might suffer and often follows a thrombotic stroke. So hemiplegia might occur after a thrombotic stroke, and the paralysis may follow a diagonal course indicating the vascular origin. And this actually represents the terminal segment of the pathology. So paralysis is the terminal segment of the pathology. So if we know the segments of Bothrops lanceolatus, and if we can break, or if we can if we know the segments of the cycles, we can break the cycle, and we can uh, we can reduce the upcoming fatal situation or the end situation of the patient, which might result in paralysis. So there may be aphasia without tongue paralysis, day blindness, emerosis, and optic nerve involvement. There can be optic nerve involvement. Why? Because in the last segment, in the second last segment, we have seen that there might be bleeding, discharges, and there might be bleeding, and bleeding in the form of retinal hemorrhages, which might result in um, blindness or the optic nerve involvement, and there can be difficulty in vision. So speech loss occurs due to cerebral damage, not muscular weakness. So it's not because of the mobility of the tongue, it's actually because of the cerebral damage with which the patient has gone through from the initial stage. And so these were the segments actually on which the Bothrops lanceolatus is based upon. And then we will move on to the basic differentiation, that is the Lachesis and the Bothrops lanceolatus. So Lachesis is actually more excessive, intense, and hot, whereas Bothrops tends to be more inward, more towards closing, thrombi, and it's a chilly remedy. Lachesis craves oyster, it craves fishes in meals. There is usually left-sided complaints in Lachesis, and there is right-sided complaints in Bothrops lanceolatus. Patient is better by discharges in Lachesis, although there is no such modality found, but still we have learned in today's session that there is discharges and patient feel better by discharges. but there is no such documented modality found. Sensation of suffocation and strangulation on lying down, particularly when anything is around throat, compels patient to spring from the bed and rush for open window in lachasis. And in Bothrops lanceolatus, there is red, dry, constricted, swallowing difficult, cannot pass liquids. Then in lachasis, gnawing pressure made better by eating, but returning in a few hours. Perceptible trembling, movement in epigastric region, empty swallowing more painful than swallowing solids. So this was about lachasis. In Bothrops, epigastric distress, black vomiting, intense hematomasses, tympanitis, and bloody stools, which we have seen in the part of discharges that the patient might suffer from bleeding, and bleeding can be in the form of hematomasses, melena, um, and in the form of vomiting and loose stools or the bloody stools. Okay, so according to Dr. J.H. Clark, clinically, if we will look upon to Bothrops lanceolatus, there are some of the symptoms which he has documented in his Materia Medica. That is amaurosis. Clinically, amaurosis, day blindness, aphasia, inability to articulate without any affection of the tongue, paralysis of one arm and one leg only, diagonal course of symptoms, hemiplegia, deep gangrene, bones laid bare, and necrotic. So these all symptoms I have discussed in the segments which are documented in the cycles previously. Now, the miasmatic analysis of the symptoms of Bothrops lanceolatus. So, the symptoms which fall in SORA, psychosis, syphilis, and tubercular. SORA, apprehension, vertigo on movements, blurred vision, aggravation, eating after, and there is a tail. Then, in psychosis, patient might suffer from erysipelas, also known as Saint Anthony's fire, in which there is excess of burning, eruptions with excess of burning, which a patient feels, thrombosis, increased sexual desire, pulmonary congestion, edema, and swelling. Syphilis, there can be necrosis, gangrene, aphasia, paralysis, and ulcerations. Then in tubercular, there can be hemorrhage, epistaxis, purpura, carbuncles, and suppuration. So these are the miasmatic analysis of the symptoms of Bothrops lanceolatus. And now these are the rubrics from different repertory which corresponds to Bothrops lanceolatus, like mind, aphasia, apoplexy after, mind, aphasia, paralysis with one side, mind, mistakes making, speaking in words, wrong words using, mind, speech, inarticulate, mouth, paralysis, tongue, vision, dim, daylight, vision, dim, daytime, vision, loss of vision, daytime, extremities, paralysis, hemiplegia, extremities, thrombosis, eye bleeding from eyes, conjunctiva, bleeding from eyes, retinal hemorrhages. So these are all the symptoms which corresponds to Bothrops lanceolatus. Eye paralysis, optic nerve accompanied by retinal hemorrhages, as we have already studied. Female genitalia, metrorrhagia, genitals, hemorrhage, blood, non-coagulable, genitals, hemorrhage, blood thin, genitals, hemorrhage, of the body from genitals, inflammation, gangrenes. So these are all the rubrics which corresponds Bothrops lanceolatus. Now, this is basically systemic thrombotic syndrome, and it's basically a clinical potential. Since there are lots of ongoing clinical trials which are going on because of increased inquisitiveness regarding the working of homeopathic medicines and to actually explore some of the rare medicines. So as Bothrops lanceolatus is one of the medicines which are actually not frequently used. So for that, I have added this slide, and because definitely we need to know regarding more of it. So the more clinically proven symptoms can be documented for further help in our not only in clinical practice but also for academic exploration. So, systemic thrombotic syndrome and clinical potential. This slide actually highlights the clinical significance and future potential of Bothrops lanceolatus in homeopathic practice. The venom of the Bothrops lanceolatus snake is known to cause a systemic thrombi syndrome. So, the venom of Bothrops lanceolatus can cause systemic thrombotic syndrome, meaning widespread clot formation in blood vessels. So, this means actually there is widespread clot formation in the blood vessels, which can affect major organs such as brain. And if a clot or the thrombus is formed in the brain, it results in stroke. Second, in heart, which results in myocardial infarction. If it's present in lungs, then it results in pulmonary embolism. And if it's present in peripheral veins, it might result in DVT, that is deep vein thrombosis. So this explains why the remedy has a strong affinity of the vascular symptoms. So actually, because of this, we can treat certain condition, or we can clinically correlate with a particular symptom, and the disease and the medicine can be prescribed on the therapeutic basis also. So, for the conclusion of this slide, Bothrops lanceolatus actually emerges as a clinically significant yet unexplored homeopathic remedy with marked affinity for the vascular and nervous system. Its symptomatology unfolds in a distinct segmental and cyclical pattern, as we have studied, beginning with mental rigidity and obstinacy, progressing to thrombotic closure, and then comes the restlessness and inflammation, and which culminating in weakness, paralysis, and neurological deficits. And why it was necessary to actually discuss this topic, because understanding this sequential evolution of disease allow the physicians to recognize pathology at an early stage. So it helps us to identify a pathology at a very early stage, even before irreversible structural damage occurs. The strong correspondence between the toxicological effect of the venom and the clinical indications in potentized form highlights the relevance of the law of similars in managing thrombotic cerebrovascular conditions. Although the current knowledge is largely derived from clinical observations and toxicological data, rigorous drug proving and scientific validations are essential to fully establish the therapeutic scope of this remedy. So actually the clinical observations or the clinical data or the toxicological data is actually very, really very less. So we need more of clinical trials, or more of experimental studies to be done to explore this remedy for rigorous scientific validation, as for to fully establish the therapeutic scope of this remedy. With further research, Bothrops lanceolatus has the potential to become an important homeopathic medicine in management of stroke, thrombosis, and vascular emergencies. So the takeaway message for this, that Bothrops lanceolatus teaches us that disease is not just sudden. It progresses step by step, and if we learn to read the early signs, we can intervene before destruction sets in. So if we know the specific phase or the specific segment, and we know the corresponding symptoms, and we know when to prescribe Bothrops lanceolatus, then we can actually break the cycle, and we can actually stop the pathological irreversibility with which a patient might face, like the paralysis. And in paralysis, we have read regarding hemiplegia and aphasia. So this is actually very important. And one more thing which I would like to discuss is the law of similars for the last slide, that is systemic thrombotic syndrome, that according to the principle of similia similibus currenta, a substance that can produce thrombosis in a crude form may help dissolve or regulate thrombotic tendency when used in potentized form. So if the venom has the ability to reduce thrombosis in the crude form, it can actually help to dissolve or regulate thrombotic tendency when it is used in potentized form. So the Botrops lanceolatus in potency is believed actually to act upon thrombotic strokes, hemorrhagic strokes, coronary occlusions, DVT, deep vein thrombosis, and embolic condition. And as we all know that there is no large scale formal proving or the experimental studies, so definitely we need to actually provide that inquisitiveness or to convey that inquisitiveness to perform the large scale provings or the experimental studies. And the current symptom picture is actually derived from clinical observations, toxicological effects of the snake bite, homeopathic clinical experience, and the remedy is actually clinically promising, but it is underexplored. So this was all regarding the Botrops lanceolatus. So if any questions regarding today's presentations or today's presentation, or if there is any kind of query.
So thank you, Dr. Pavitra. It's time for discussion. Those who would like to participate, please raise your hand. Dr. Hema, would you please proceed? You are the moderator. Please unmute. Please, okay, yes. Yeah.
It was really a wonderful section about a less known drug, Botrops. Actually, she made it is she told in an easy manner all the 7 segments and the cycles of Botrops, and he stressed the importance of Botrops in thrombotic conditions. It was really a nice section to deal with, and I'd like to call Dr. Abraham Vaidyan sir to share his experience regarding Botrops or any snake remedy. Actually, Dr. Pavitra had made a good comparison with Botrops and Lachesis. Lachesis, we are more familiar with the drug Lachesis, but Botrops is less known to us. But she made a good comparison, and I would like to invite Dr. Abraham Vaidyan sir to share his experience with the snake remedies or
He's not in the
Botrops or
participant list.
Lachesis.
He's not in the participant list.
Okay,
He
okay.
left.
Okay. Is there anybody to share their experiences with the snake
It's the
remedies
duty
or
of the
Botrops
participant to
or
participate. There's no doubt about that, but we often fail in participate discussions. So the medicine becomes more important because of the situation. The old age population is increasing in India, especially in Kerala. So definitely this medicine can play a pivotal role. Another thing is that the post-vaccine era, especially after the COVID vaccines, a lot of hemorrhagic conditions undoubtedly increased beyond the speculations even. That much quantity is there. Then another thing is the lifestyle disorders are increasing. A lot of heart diseases. But in all these cases, this medicine can play an important role. So we must all study. Especially your presentation is good, but I think it is quite rapid. Since you are a teacher, you must reduce your pace. Then some sound modulation is an important factor, so that the student can grasp it more easily. But is there monotonous speaking? Kindly avoid, because we never get enough training as teacher in our medical colleges. Even a nursery school teacher will get training, but unfortunately the professional school can't. Never. Not however in all systems. So that's the problem. Especially the material medication is a vast subject. It was in fact taught by masters like Ken Dunham. Then another, of course. So that kind of presentation is needed. Then another thing is that we have 3 different terms: the drug, the medicine, and remedy. So don't use loosely these terms. Drug is totally different from medicine, and a medicine is even different from drug. This remedies. So remedy is totally different from drug medicine. So you should, especially a teacher, so it should be use utmost caution when this using the homeopathic terms, I think. Anyway, nice presentation. All the best. Thank you.
Thank you so much, sir.
Actually, Dr. Pavitra revised the topics 2 to 3 times regarding the segments and cycles, and it is really easy to understand for us. Okay, is there anybody to clear any doubts or share their experiences?
I think there is one medicine this without going with regular meals feels better is not the move. Then again, this medicine also has got the eating aggravation. So it's better to add one or two medicines when you're taking a simulation, the diagonal presentation of symptoms, then some other snake medicines. So this will further improve the quality of teaching as well as the learning process. I think our Madhusudan Panikar sir is the most experienced campaigner to talk about these medicines. Sir, please, what is your insights in this? Both of sir, Madhusudan Panikar sir, please unmute. Yes, sir.
Hello, Kekao.
Yes, sir, audible, sir. Yes, yes.
Fine. We done a research work in 100 patients with CAD, coronary artery disease, and put a scientific seminar paper in Sarda Krishna Medical College before 3 years. The result is very, very effective, and entirely our research work scientifically proved by that the prothrombin combination is prevented by this Bothrops lancinatus too. So ultimately the end result is to prevent the clot. This is the miracular work done by Bothrops lancinatus. We train, I think, for last 5 years in 1,000 patients with coronary artery disease and other medicines. We used as calcareous, cretatus, adonis. They, according to the symptoms and radiating pain and other pathological conditions concerned. But there is no complications in these cases. So ultimately, the Bothrops lancinatus is a very good medicine for preventing clot.
Yes, sir, that's the most important observation. Recently, there was an article in Times of India where it says that this using of the stents along with this laser often giving some kind of relief, but that is not at all sufficient. So this can be added as a complementary medicine there, I think, I hope.
Definitely, sir, because even for last many decades, the modern medicine cardiac authorities use with antiplatelets, anti-hemorrhagic like acospirin, clopidogrel, and likewise the medicines for years and years. But unfortunately, after 3 or 5 years, they again says that the block is too more, so you have to go on open surgery or the stent application.
Yes,
After even the stent application, after 3 years, they again says that with all these medicine, they again says that there is a block. So
yes,
even 8 or 9 stent, even in an individual, they applicate within 1 to 10 years.
yes.
So they know that. But ultimately, our medicine is very, very effective in my practice.
Yes,
There is no failure with the blessings of Bhagavan and Samul Hanuman, our hard work and prayer. There is no incidence of failure. Okay.
yes, sir, very good. Thank you, sir. Now, Dr. Karnar is time. Dr. Karnar, please unmute.
Sir, good evening. Very nice presentation, ma'am. You have explained clearly the pathophysiology of lancets and other things. I have listened. One of my professor, Praveen Kumar sir, has treated one case. The homeopathic student is under coma. He explained he has used both wraps to resolve the clot. She is completely going to coma. She is on 3 months, more than 3 months in coma. The allopathics are raised their hand, but he was used both wraps in different potencies along with laxative or some other medorinum, maybe I thought. So the student was completely recovered from the coma stage, and now she was practicing homeopathy very nicely. That incident was happened at she was studying third BHMS maybe. So later on, so I used both wraps not in resolving the clot, but nymphomania cases, patients has developed a headache or some restlessness, all other things. They are resolved by these both wraps. But I have doubt, ma'am.
Yes, sir.
Some our senior, I see. Can we use both wraps as a preventive? Not especially we are having risk factors to provoke the cardiac. Nowadays, there is a technology is available to know the cardiac risk is there or not. Cardiac markers are there, lipotropins, all other things. Every routine checkups in the corporate sectors, they have noticed there is a rising of lipoproteins, all other things. Can we use this both wraps as a preventive to prevent that clot thing? Is it an idea, or can you have any experiences about this? And one more,
Sir,
yeah, tell me.
no, sir, you complete first.
One more suggestion. Sari said there is no failure. I have good experience like that. So such a wonderful results are there. Whoever more inspiring persons are acquaintance with the public figures, maybe to introduce by a public figures to introduce our system is great efficient. In such a cardiac cases, there is a lot of scope is there. You are poisonous cases, lot of scope is there. Some public figures are announced this system is good and these drugs are, maybe there is a it reaches to the public government sector, they will start a research work and maybe use it for so many cases are died in the village levels, snake bite or nowadays injections are failed. There are so many, whatever the consequences you have explained here, the same status of cases, but patients are not in a position to believe and not aware. Both are things are there and not encouraging by allopathic people. With the encouragement of or support of allopathic people, we will succeed. So that's why government has proposed integrated treatment, integrated systems in a present scenario. We have introduced in an international seminar, this is the pathophysiology of so-and-so drugs, nicely resolved by whoever risk group is there, we have to administer. Why we are not conducting one research work in that level and proposed or show the as a evidence this drug has reducing the risk factor or the pathology bring back to the normalcy and the recovery rate. Maybe there is an inspiration of why, because government has spending more lot of money and more awareness programs about this cardiac and arrest nowadays in the younger age groups. So the cardiac arrests are common in even emotional disturbance and other things. So it may be my suggestion, whoever in that position in our group or some other things are close acquaintance with the public figures, we have to introduce like this. Maybe there is a not only publicity to our homeopath, but so many people are survive from the complications.
Okay, doctor. Okay. Okay.
Sir, 1 minute. Sir, further advantage is that we can, when we withdraw the aspirin or ecospirin, we have to match the ANR with this our bothrops. So always the patients fear to withdraw the ecospirin. Even the doctor says it is injurious, but we can prove it with observing the INR. We can make it in the normal level by our Bothro 03 twice daily. We always doing this, even cardiologist, when we advise for the echocardiogram or angiogram, our treatment is like this. We referring letter, we include these all thousands, they are accepted and appreciated.
Yes, sir. Very nice. Very nice.
Yes. Yes, Dr. Pavitra, do you want to add anything more?
No, sir. I'm completely
So,
done.
can we conclude?
Yes, sir. Definitely, sir.
Yes, over to Dr. Hema Shekhar to conclude the session.
I would like to thank Dr. Pavitra for such a wonderful section. Very wonderful and informative section. And I would like to thank one and all who are here, all the homeopathic doctors and homeopathic lovers on behalf of IFPH. And a very good night to all. And thank you once again. Thank you, Dr. Pavitra ma'am, for
Thank you, ma'am.
dealing with segmental and cyclical effects of both drops. And we have to learn much more about the drug uh, and we have to use more the drug both drops in our practice and all. Okay, as our seniors have said, it have a very good effect in many cardiovascular conditions, and we have to use the drug more effectively. And your section had given a nice information about the drug. Thank you, ma'am.
Thank you, sir.
Thank you, Dr. Hema Shekhar, and those who attend the session. Tomorrow, we will have a session from Professor Dr. Rinku Vishwas, and Doctor will be talking about hepatic disorders and homeopathy. With that, we come to the end of the day 2003rd day. Thank you all. Good night. It's over to Dr. Mariama Joan to moderate the Malayalam session.